वक्रतुंड महाकाया सूर्यकोटि समप्रभा निर्विघ्नं कुरु मे देवा सर्वकार्येषु सर्वदा. Hey Lord Ganesha, give us the nobility, stability, ability, agility, and tranquility which is required for becoming a NEET PG topper. With a vandanam to you, we are making a great start. Next 4 months, September, October, November, December, in these forthcoming 120 days, we pledge to give fullest of our energy in order to study with focus, clarity, the high-yield topics and fulfill the purpose of our birth to become a specialist doctor. Good afternoon to everybody. This is Dr. Murli Bharadwaj, your classmate in everyday NEET PG preparation. Today, on this auspicious day of Ganesh Chaturthi, let us start the discussion of the small topics. Within 10 points, how we can be able to summarize each topic. There are about 953 topics that you need to master before you go to the NEET PG exam. Nipple discharge. Lot of times the question is asked in the surgery. When do you call it as pathological? You should remember, if it is unilateral, spontaneous, bloody, serous, and clear or associated with a mass, that is called as pathological. In that scenario, how do you evaluate, doctor? Mammography and subareolar ultrasound is considered to be the investigation of choice. When do you call or consider that the nipple discharge is physiological? Whenever it is bilateral, involving multiple ducts. If it is milky or if it is greenish, if it is associated with the nipple stimulation, not spontaneous, or if the breast compression is causing the discharge, then it is considered to be physiological. Similarly, if the age of the patient is less than 39 years of age, that is also considered to be physiological. And any psychiatric drug, antipsychotic, which is dopamine inhibiting, that can lead to development of galactorrhea because of increased production of prolactin is what you should remember. Now, a clear serous discharge in a Paris woman. This is a common clinical vignette given by the examiner. What are the three things that come to your mind, doctor? Physiological, duct papilloma, or mammary dysplasia. Any of them can lead to a clear serous discharge in Paris women. Now, what is the most common cause of the spontaneous nipple discharge from a single duct? You should think solitary interductal papilloma is one of the large solitary subalveolar duct involving under the nipple. It is considered to be the most common cause of the spontaneous nipple discharge from the single duct is what you should remember. Similarly, if the examiner gives you bilateral multiple duct discharge, what do you want to do? Do you want to do surgical biopsy? That is what examiner will ask. No sir, there is no need of any surgical biopsy is what you should tell. Because the most common cause for a bilateral multiple duct discharge is a benign pathology, and that is intraductal papilloma is what you should remember. Now, as a quick summary, these are the things that you should remember. Definitely one MCQ is going to come. Discharge from single duct. So you are going to remember If it is blood stained, three things: intraductal papilloma, intraductal carcinoma, or ductectasia. Discharge from the single duct, it is serous or any color. Think of fibrocystic disease, ductectasia, or carcinoma in that order. Then, if it is a discharge from more than one duct, how are you going to remember? So, blood stain, if it is blood stain and more than one duct, think of carcinoma, ectasia, fibrocystic disease, even if it is from more than one duct. If it is black or green, it is a benign pathology like ductectasia. More than one duct and purulent, think of infection. More than one duct, if it is serous, think of fibrocystic disease, ductectasia, or carcinoma in that order. And if it is milk, then you should never forget. Hypothyroidism is something that you need to remember. More than one duct, if the milk is getting discharged, think of hypothyroidism and also pituitary tumor. So that is a quick summary. Quite often an MCQ comes. So join the Dr. Murli Bharadwaj Super 2000 batch. For that, there are lots of discussions, MCQs, image-based questions when you join our nationwide NEET PG WhatsApp study groups. Thousands of students are part of this group. You will find study mates, probably in your own city or any city. So please call 900868 in order to join the Super 2000 WhatsApp study group of Dr. Murli Bharadwaj. So I wish you all good luck, and I am the everyday study partner with you to inspire you to prepare for the NEET PG exam. Thank you.